Consumer health, guidelines and criteria in the selection and evaluation of the health information, products, and services. Part 3. More and more tools are available to help you make smart choices. Take advantage of these resources and take charge of your health care. Guidelines and criteria in the selection and evaluation of health information, products, and services are stated here. Credibility involves consideration of information, source, currency, relevancy, and editorial review process. Source. The source of health information is one of the most important criteria to determine its quality and credibility. Does the site display the author's name if relevant? Can you find the qualifications or credentials of the author? Currency. The date of which the original information is based should be displayed. The date of posting of the web should also be displayed. Relevance. Thus the content of the site corresponds to the information it claims to offer. And review process. Does the site have a seal of approval from an individual or group commonly perceived as credible? Second, content. Content should be accurate and complete, with an appropriate disclaimer provided. Accuracy. The site should identify the data that underlies the conclusions presented. Clinical or scientific evidence should be clearly stated. Users must be aware that testimonials are not evidence. Disclaimer. A website should have a disclaimer describing the limitations, purpose, scope, authority, and currency of the information. Sources of information should be disclosed. Readers should consult a health professional before making any health decisions. And completeness, does the information appear to be complete? Next, disclosure. Disclosure requires that a site inform users about any collection of data about them while at the site and how that data will be used. A website should clearly state the purpose of the site. Users should be informed of any collection, use of this or dissemination of information associated with using the site. Users should be informed who is collecting what and who owns the data collected. Next, links. Links should be included so that users can verify content on the site, and they should lead users to other reliable sources of information. Especially critical to the quality of a site are its external links that will lead readers to other authoritative sources. Links should be included to other appropriate sites so users can read further on a topic. Content of our originating site is more credible if it provides links to high-quality sites. Next, design. Design does not affect the quality of the content. However, it can have significant effects on the delivery and use of the information. Is the site logically organized or easy navigation? Is the site focused on the purpose and target audience? Does the information reflect the reading level of the user? And next, interactivity. Interactivity does not affect the quality of the content. However, it is important to provide contact information and feedback options on the site. A good website should include a feedback mechanism for users to offer comments, corrections, and raise questions. A website should be accountable to the users. So, who are our healthcare providers? A primary care physician is someone who treats minor illnesses, answers health questions, conducts health checkups, performs routine health tests, including those for cholesterol or blood sugar levels, provides referrals to specialty physician when necessary, keeps a person's medical records together. And here are some examples of healthcare providers. Allergists. An allergist or immunologist focuses on preventing and treating allergic diseases and conditions. Dermatologists. Dermatologists focus on diseases and conditions of the skin, nails, and hair. They treat conditions such as eczema, skin cancer, acne, and psoriasis. Dermatologists can perform some in-office procedures, including mole or spot removal. Infectious disease doctors. Infectious disease doctors specialize in diseases and conditions that are contagious. Ophthalmologists. Ophthalmologists specialize in eye and vision care. They treat diseases and conditions of the eyes and can perform eye surgery. Ophthalmologists treat people with complex eye conditions and may also see people for routine eye care, including prescribing glasses and performing checkups. Obstetrician or gynecologists. Obstetrician or gynecologists provide preventive care and disease management for female health conditions. Many women will see an OB/GYN regularly throughout pregnancy and for labor and delivery. Cardiologists. Cardiologists focus on the cardiovascular system, which includes the heart and blood vessels. Cardiologists can perform many tests and procedures. However, they do not perform heart surgery. Endocrinologists treat disorders and conditions that affect the endocrine system. This system involves various glands that make and release hormones in the body. Gastroenterologists focus on the digestive system. This includes the esophagus, pancreas, stomach, liver, small intestine, colon, and gallbladder. Gastroenterologists also perform procedures such as endoscopy, sigmoidoscopy, and colonoscopy. A nephrologist focuses on kidney care and conditions that affect the kidneys. Nephrologists also have education in kidney transplants and dialysis. Urologists treat conditions of the urinary tract in both males and females. They also focus on male reproductive health. Some urologists focus on a specific area within urology, such as female urology or male infertility. Pulmonologists focus on the organs involved with breathing. These include the lungs and heart. Pulmonologists may work in hospitals to provide ventilation or life support. They also see people in the office to treat breathing disorders, lung conditions, and allergies. Otolaryngologists are sometimes known as ear, nose, and throat doctors. An ENT doctor may treat problems with the sinuses, throat, tonsils, ears, mouth, head, and neck. Some ENT doctors undergo additional training to focus on one specific area, such as pediatrics or rhinology, which refers to the nose and sinuses. A neurologist treats conditions of the nerve, spine, and brain. A psychiatrist is a doctor who treats mental health conditions. They may use counseling, medication, or hospitalization as part of their treatment. Some psychiatrists have a subspecialty in a specific area, such as adolescent mental health or addiction medicine. Oncologists treat cancer and its symptoms. During treatment for cancer, a person may have several types of healthcare professional in their care team. A radiologist specializes in diagnosing and treating conditions using medical imaging tests. They may read and interpret scans such as X-rays, MRIs, mammograms, ultrasound, and CT scans. A rheumatologist diagnoses and treats rheumatic diseases. These are autoimmune conditions that can affect the bones, joints, and muscles. General surgeons perform surgical procedures on many organs and bodily systems. An orthopedic surgeon specializes in diseases and conditions of the bones, muscles, ligaments, tendons, and joints. Cardiac surgeons perform heart surgery and may work with a cardiologist to determine what a person needs. Cardiac surgeons perform procedures including heart bypass surgery and placing stents in the heart.